Imad Kasir, your host, and welcome to a special broadcast on World Diabetes Day. Today, we are shining a light on one of the most pressing health issues of our times, diabetes. Every year on November 14th, the world observes World Diabetes Day, marking the birthday of Sir Frederick Banting, one of the scientists who discovered insulin, a breakthrough that changed millions of lives. But here's the thing, after even a century has passed, yet diabetes is still on the rise. Globally, above 500 million people live with it, and in Pakistan, the situation is deep concerning as studies show that nearly 1 out of 4 adults is affected, and it is the largest, one of the largest causes of death and chronic illnesses. Yet, it remains highly preventable and manageable through life changes, awareness, and proper health care. And to help us unpack all this, we are joined by someone in our studios today who knows diabetes inside and out, Dr. Sarwar Malik. He's consultant endocrinologist and diabetologist, and he is the head of the Department of Endocrinology at the CDA hospital here in Islamabad. With years of experience in treating patients with diabetes and raising awareness, Dr. Malik will help us understand what exactly diabetes is and why is it growing so fast, and most importantly, what we can do about it. So Dr. Sarwar Malik Saab, welcome to the show, and thank you very much to join us in this studio. Ji sir.
Bismillahirrahmanirrahim. Thank you, Ahmed, for your kind introduction. I am deeply thankful to Radio Pakistan and its team for inviting me to join this program today, especially in connection with World Diabetes Day. As you already mentioned, every year on 14th November, World Diabetes Day was observed throughout the world. Why it was observed? To create awareness about the diabetes, its prevention and management. The purpose is to help people to understand what is diabetes and to help them how to protect and how to they live with active life. This is the basic aim of World Diabetes Day. And throughout the Pakistan, not throughout the Pakistan, even throughout the world, there are programs are going on these days. If we control our diabetes, then we can live like a person who is not diabetic. As you stated, currently globally 589 million people they are living with diabetes, and the most alarming thing is 1 in 2 people they have diabetes, but they do not aware they have a diabetes. The most alarming fact is about 77% of the people they have diabetes. They are living in middle and low income countries. These are the countries where people are even facing so many challenges. Being a diabetic, they add even more difficulties for their life to have a good health care and to go to a diabetic specialist. So more than 77 million percent of the people who are diabetic, they are living in low and income countries. Every 7 to 9 seconds, one person lose his or her life because of diabetes and its complication. You can imagine how much it is serious. In last year, almost 33.4 million has been died because of diabetes. It is really very alarming. And to have a good diabetes control, there is no issue. If we follow a simple things, we can have a good diabetes control that are very easy. For example, if you have a take regular exercise, take medication as per your doctor's advice, you are stay active, and you are connected with your doctor. If you follow these simple things, you can live with diabetes as a healthy, active, effective, and energetic person.
And that's really great. Dr. Sarwar Malik Saab, you mentioned the statistics which really are alarming, and you mentioned that there's a large number of people who are affected by diabetes, and you mentioned that with a healthy lifestyle it can be managed. Can you please enlighten our listeners about what exactly diabetes is for those who may not fully understand what is diabetes?
Basically, diabetes means increased blood sugar levels above the normal limits. The most important thing is you have to know what is the normal blood sugar levels. For a normal person, the fasting blood sugar level is less than 100, and after any meal, 2 hours blood sugar level should be less than 140. If a person has a blood sugar more than 100 in a fasting state and 2 hours after meal more than 140, then this is called dysglycemia. And for diabetes diagnosis, the fasting sugar should be more than 126, and any 2 hours after meal blood sugar should be more than 200. The range in between these 200 and 126 and 140 to 200, that is called pre-diabetic patient. These pre-diabetic patients are a very high risk patient. They have 70% chance go into diabetes in next 4 to 5 years. But there are 30% chance if they adopting effective and healthy lifestyle, they can protect them from developing diabetes. So it is very important for general population to know what is the normal sugar level, what is the sugar level for borderline diabetes, and what is the sugar level for diagnosing a diabetes level. There is another criteria to diagnose diabetes that is called HbA1c, or in simple words, you can say A1C levels. The normal reading for A1C should be less than 5.7. For pre-diabetic, it should be 5.7 to 6.4. For diabetic, it should be more than 6.4. But there is a very important point. So our general population should know it. Although it is a costly test, most of the time people go for the costly test, not for the simple test, because this test needs a specialized instrument and specialized calibration. So some good laboratories can do this test. In our country, each and every laboratory is doing this test. So reliability of this test is not validated in our population if they are not following the standards. So first we should go for the simple test, blood sugar level either in the fasting state or random state. If they are impaired, then we should go for HbA1c level.
Dr. Saab, you mentioned that we should have our blood sugar tested. So, how frequent one should go for those tests, and what are the early signs before one should go for the tests?
This is very important question. How frequently they should go for test? If we go back in 20 or 40 years ago, at that time it is said the most common type of diabetes is type 2 diabetes. People needs to get their blood sugar test after 45 years of age. Then after a couple of years, it is said that they should need to test after 40 years of age. Now they are saying they should need to test their blood sugar level at age of 35 if even they have no other risk factors for diabetes. Risk factors for diabetes include obesity, hypertension, dyslipidemia, cholesterol level is increased. Kids with obesity, their family history is strong for diabetes. Girls with polycystic ovarian syndrome and some other conditions that increase risk of diabetes. In those conditions, you can go even in teen age for blood sugar levels if they have a risk factors. If a person is not have a risk factors, then we have to go for blood sugar test at the age of 35 years. If the sugar level is normal, then it depends when we have to repeat again. If risk factors are low, then you can repeat after 1 or 3 years. If the risk factors are high, then even you can repeat after 6 months.
All right. So having factors like you mentioned, so then you should go for a test on after every 6 months. Otherwise, 1 year or maybe, as you mentioned, after 3 years. So what are the major risk factors which cause diabetes?
The most important risk factor is we are nowadays facing is obesity. Almost you are more than 50% of the adult population is suffering from obesity. Obesity means you are having a more fats in your body. When you have more fats in your body, then you have a insulin resistance, and there are more chances you have to develop diabetes earlier if you are not obese. So the first and most thing is obesity, and obesity is because of your dietary habits, your lifestyles. You are not walking, you are spending your life as a sedentary. Along with, if there is a family history of diabetes, this is also a strong risk factor. If some woman has a diabetes during pregnancy, and she is also prone to develop diabetes in near future if not adopting a healthy lifestyles. Along with some person who has a hypertension, increased blood pressure, and at the same time if he or she is suffer from cholesterol level. And some girls, they have a condition called polycystic ovarian syndrome, and some endocrine disorders, although they are rare, but they are also contributing diabetes development like Cushing syndrome, along with hypothyroidism, acromegaly. There are so many other rare conditions as well. But the common conditions are obesity, that comes because of your dietary habits and lifestyle, along with hypertension, dyslipidemia, family history of diabetes.
So these are all the factors that cause diabetes, sir. And you mentioned that we see diabetes in at an early age also. So what would be your advice to especially our young people watching this transmission, that what should they do to avoid or to prevent such
Yes,
disease?
this is also very important question for young people. They have to adopt healthy lifestyle from today. Healthy lifestyle means they have to take at least 1 hour for them on daily basis for either exercise or walk. If they are unable to do 1 hour on regular basis, then they can divide into 20 minutes in the morning, 20 afternoon, and 20 even evening. If it is difficult for them, then they can do walk for at least 10 to 15 minutes every 2 to 3 hours to take a full 60 minutes walk per day. This is very important. There is no timing bound. They can do whenever it is feasible for them. Along with some foods, they should be avoided because these foods are generally, you can say, unhealthy foods, but they are tasty foods. They have addiction capacity. These foods like cold drinks, cold beverages, sugary beverages, soft drinks, processed juices, along with chocolates, desserts, sweets, bakery items. They have a big potential for addiction. If you started, you have to take lot of them. These factors lead to spiking in sugar, increase weight, and there is also chance these people can develop hypertension because of these processed foods have increased amount of salts, and at the same time they can develop cholesterol levels. So you have to avoid these things. Along with, if you do a regular exercise, if you are prone to have a develop to diabetes in near future, you can delay this development even for 10 to 15 years.
Right. So what are the first steps, as you are mentioning that if someone is diagnosed diabetes recently, what should they do to avoid? You mentioned exercise and this food. What else they can do, sir?
The first and most important thing, once they are diagnosed, they have a diabetic, they have to consult with a qualified doctor. Because if they are not consulting, in our culture, you have observed, and we are also observing, that most of the people, they are taking advice either from their family members or either from their friends, or they have taken to do things which are they are seeing in the social media and some print media. So the first and most important thing, they have to consult with a doctor. The doctor has to examine this patient, not examine this patient also along with diabetes. They have to check so many other factors like blood sugar. Along with blood sugar, they have to check cholesterol levels, they have to check blood pressure levels, they have to check kidney function levels test, they have to check liver function test, they have to check feet examination, they have to go for eye examination. These are very important things. At the same time, then doctor is able, after seeing all these investigations, examinations, what medication this patient can get and benefited, because there are a lot of medications along with insulins. Some medications we have to avoid in obese patients, some medication we have to avoid in lean patients. Some medications are preferred if the person have same time cardiovascular diseases or kidney problems. So the decision regarding the medication prescription depends upon the doctor's assessment. Not only medication, if the doctor has prescribed medication, then it is very important to take medications as exactly as prescribed by the doctor. Never ever skip medications, never ever stop medications without consulting the doctor. At the same time, you have to regular follow visits with your doctor, because sometimes there is a need to modification of your prescription, and sometimes we have to de-escalate the medication, means we have to reduce the medication doses. If a person is adopting healthy lifestyles, doing regular exercise, taking dietary precaution, and sometimes there is a need to increase the doses of medication, and sometimes we have to continue with the same medications, but we have to encourage the patient that you are doing good job, your medication is working well, your sugar is controlled, your blood pressure is controlled, your cholesterol is controlled, you are doing fantastic job. So the patient get encouragement. These factors lead to healthy, active, and energetic life. Along with this dietary precaution, medication intake, regular visits, physical activity, these are the basic fundamental principles which a diabetic patient has to adopt.
Right, sir. So regular follow-up is important, as you just mentioned. Sir, enlighten us on the types of diabetes, as people often get confused in type 1 and type 2 diabetes. So tell us about that also.
There are broadly 4 types of diabetes, but simply you can say 2 types are commonly used. One is type 2 diabetes and the other is type 1 diabetes. Type 1 diabetic, these are people, they need insulin from the day of diagnosis, because this is autoimmune condition. Some antibodies are produced in the body because of the immune system, and these antibodies leads to pancreatic beta cells which are responsible for insulin production. Once the pancreatic beta cells are destroyed, usually at the diagnosis of the time of the diagnosis of type 1 diabetes, almost more than 90% of the pancreatic beta cells has already destroyed. So these patients and these people need insulin from day of the diagnosis. You can say insulin is their life. Insulin is as essential as water, as sleep, as diet. We can't live without these 3 things. So without insulin, we can't live for longer time. We can survive for a couple of months, but daytime is also miserable because of the deficiency of insulin. We suffer a lot of complications. This is type 1. So type 1 people needs insulin from day of diagnosis. It is very important. Sometimes these kids are misdiagnosed, and sometimes they are going to CAVEX and they started some medication, and these kids are usually suffer from lot of complication. And usually type 1 diabetes develop during school going years, 5 years, 10 years and 20 years, early teens. The second most common type, you can say, accounts from more than 90%, that is type 2 diabetes. Type 2 diabetes usually developed later on. As I already said, initially it was developed after 45 years. Nowadays, because of not adopting healthy lifestyles, it is also observed and seen and diagnosed even in late teens. So in type 2, usually there is insulin resistance, and the capacity of producing beta cells insulin is not per requirement of their sugar levels. So you can say there is a relative insulin deficiency, and at the same time there is insulin resistance. And when you have diagnosed type 2 diabetic patient, lifestyle are very important. Along with, then there is a need to select the medications, because there are multiple group of medications available for type 2 diabetic patients. So judgment of the doctor is very important, which patients needs which medication. There is another type of diabetes which is called gestational diabetes. This type is usually developed during pregnancy. Most of the time after delivery, the diabetes is not more there. But these women are also prone to develop diabetes later in life. Almost there are 60 to 70% chance they will develop diabetes in the next 5 to 10 years. But these women also needs to adopt a healthy lifestyle. Along with healthy lifestyle, after 6 to 12 weeks of delivery, they have to go for a special test that is called oral glucose tolerance test. That will tell whether they are pre-diabetic, non-diabetic, or diabetic. And if their test comes turned to be normal, then these women also again have to go for oral glucose tolerance test every years, because they are prone to develop diabetes. The fourth type of diabetes is called secondary diabetes. This is because of multiple other factors. Some medications, like people who are using steroid tablets, some anti-cancer medications, and some other hormonal conditions like Cushing syndrome, polycystic ovarian syndrome, along with acromegaly. And sometimes diabetes can develop because of some diseases that leads to pancreatic beta cell destruction. For example, if a person has a pancreatitis, that is inflammation of the pancreas, that leads to destruction of the beta cells, and these people are also prone to develop diabetes. And sometimes due to some other reasons, someone has undergone for pancreatic surgery and major part of the pancreas has been removed, so these people are also prone to develop secondary diabetes.
Right, sir. Thanks a lot for letting our listeners know in detail about the forms of diabetes. So, types of diabetes, sir. If diabetes is left uncontrolled, what risks are there for the patient?
As you have mentioned, and I also mentioned, that every 6, 7 to 9 seconds, one person lose his or her life because of diabetes and its complication. In 2024, 30.4 million people has been died because of diabetes. As diabetes because of increased blood glucose level, and blood glucose goes every part of your body. So diabetes complication start from head to toe. Every organ of the body can be affected because of the diabetes. Why? Because it is the increased blood glucose level in your blood, and blood has to go everywhere. So the major complication are stroke, retinopathy, and this time the leading cause of blindness, apart from some congenital diseases, is diabetes. Heart attack, the leading cause of heart attack is diabetes. The leading cause of heart failure is diabetes. And after traumatic amputation, leading cause of limb loss is diabetes. And at the same time, the leading cause of nephropathy, kidney failure, is diabetes. So there are other also factors. If the diabetes is uncontrolled, person can develop dementia, person can suffer from anxiety disorders, person can suffer from depression. Sometimes there is a lot of issues with the sexual life. Person can develop erectile dysfunction. Even if the diabetes is uncontrolled, that is also one of the cause of infertility.
Right. So, as in the start, we discussed that it is one of the largest cause of death and also leading to major illnesses. Sir, can you please let our listeners know that what are misconceptions associated with diabetes?
There are so many misconceptions. Sometimes it was thinking some people they need insulin at any stage of their diabetes control. So most of the people thinking that the insulin is the last resort to control the diabetes. If we go for insulin, then in couple of months or years we will die. This is a very big conception, because insulin is basically the actual therapy of diabetes. Because due to the insulin deficiency, we have to give medications that either release insulin or increase effectiveness of insulin to somehow. So this is a very big misconception. Sometimes people are thinking that this diabetes is like a myth, and they start to go to Cavex. They give some medications, and these medications also have some pharmacological ingredients that also leads to help in initial stages, but in long term these people have to suffer a lot of complications, especially regarding retinopathy, nephropathy, even in diabetic foot. So the most important thing is you have to consult a qualified person, and you have to follow his or her advice, not your family person's advice, even not your friend's advice, and you have not to take advice from other sources like print media and all these things. You have to adhere the advice of a qualified doctor.
Right, sir. And what will be your message to the families where someone having living with diabetes? How should they support their loved ones having diabetes?
Yes, it is very important and very important question. This solves a theme is also a diabetes and well-being, and especially related to workplace. Workplace means where you are working and you are living in a home, that is also a workplace. So if a person is suffering from a diabetes, the people surrounding them, they needs to help him regarding physical activity, dietary precautions, medication intakes, and also encourage them. If you take your medication on regular basis, if you stay healthy, if you stay active, if you have a consultation with doctor, then there is no differences between a person who is diabetic and who is non-diabetic. There are so many people who have developed diabetes in their teen age, and they are living for last 50 to 60 years without any complication. And there are so many people, they have developed diabetes in couple of years, but they have suffered a lot of complications like strokes, MI, heart failure. So it is our collective responsibility. The person who is diabetic and we are living in the same community or same circle or same home, we have to guide them, we have to encourage them, we have to help them.
Right, sir. And you mentioned that workplace, sir. So how can more awareness be spread in workplaces or in educational institutes, schools, colleges about diabetes? Because we know that people generally know about diabetes, but as you are mentioning that the signs are alarming, the stats are alarming. So why isn't still not being prevented the way it should have been?
Because for this purpose we have to take help from the government. When the government involved, and there are some rules and regulations, and there should be some educational activities, not even the healthcare institutions, but these educational activities needs to be start from the home, from our masjids, from our khankas, from our schools, from our colleges, and from our basic institutions. We have to educate our young generation. So if we are able to educate our young generation and they have start to adhere a healthy lifestyle, then we are able to combat this disease. Otherwise, there is no chance that we are able to control or prevent diabetes. This is the fundamental thing. We have to start from the baseline.
Right, sir. And being a consultant, sir, can you enlighten us that are there any recent medical advancements to prevent diabetes or the remedy? Are there any recent advancements?
At this moment, there is no recent advancements which can lead to prevent diabetes for whole life. But there are medications, there are some surgeries, especially for those people who are obese, overweight, and these medication and surgeries basically leads to weight reduction. So for couple of years, these people can go in remission, not cure, can go in remission for a couple of years, and again they develop diabetes. But this is also a blessing. If a person remain free of medication for 5 to 10 years because of these surgical procedures or some medications which helps to lose weight, but these are also a costly procedures. You can say if someone go for surgery, it costs almost more than 10 lakh rupees. If you go for these medications, they are also costly per month, more than 25,000 rupees. So the most important factor is we have to change our behavior. What are our behavior? Behavior is what are our lifestyles, how much we are taking time for our physical activity, and how much dietary precautions we are taking. These two factors are very important. Even after medication and after surgery, 10 years or 5 years, you have again developed the diabetes. So if you adopt a healthy lifestyle without these medication and surgery, you can reverse your diabetes. There are so many people which I personally know, they are diabetic. They presented to me with a HbA1c level of 11, which means they have an average sugar of around 250 to 300 at the time of diagnosis. But for last 5 years, they are without medications only because of adopting healthy lifestyle and changing behavior.
Right, sir. So before we wrap up, what would be your message and what small steps one can take to prevent diabetes?
If we follow simple things, regular exercise, take medication as per advice, stay active, we are consulting and our doctors as per advice, we are checking our blood sugar levels, we can live a normal, healthy and energetic life.
Right. So thank you very much, Dr. Saab, for joining us today. And listeners, as Dr. Saab enlightened us on the types of diabetes and also how can we prevent, and one should keep in mind that it is not diabetes who has to define our lives. Small steps like healthy diet, as Dr. Saab mentioned, and a healthy lifestyle, exercise, right eating habits, and proper medical care, we can prevent and manage diabetes. And this was our special broadcast on World Diabetes Day. And Dr. Sarwar Malik Saab, thank you very much once again for joining us.